All right, team. The patient presents with symptoms of cerebral vasculitis, hereditary gingival fibromatosis, and cytomegalovirus esophagitis.
What are we looking at here?
I think it could be a rare genetic disorder causing these symptoms.
No, it seems more like an infection that's affecting multiple systems.
I'm inclined to think it's a neurological issue, given the symptoms.
I'm leaning towards an autoimmune condition causing the manifestations.
No. And worst of all, no. You're all wrong. It's uterus didelphys. The only way to proceed is with a disectomy. It's risky, but it's our best shot at saving the patient's life.
But that's a risky procedure. Are you sure, Hawks?
I have my doubts about this, Hawks. It seems like a drastic decision.
I'm not convinced, but if you say so, Hawks, let's prepare for the procedure.
This goes against everything we've discussed, Hawks. I hope you're making the right call.
I don't give a damn what you all think. This is the only way to save our patient. Now let's get to work before it's too late. You wanted to see me, Tracy?
Yes, I heard you want to perform a disectomy on a patient you believe has uterus didelphys. Where did you get such a stupid idea?
I learned about it from my girlfriend from Canada.
Hawks, this hospital does not experiment on patients. We follow standard procedures.
Always, but we maintain a modest relationship. You wouldn't know her. She works at a different hospital.
Tell me the hospital.
It's in Cantonese. I can't pronounce it. Don't bother.
Whatever. Regardless of whether or not she exists, this idea is utterly ridiculous.
But Tracy, this patient is in critical condition. Compromised, damn it. It's what my girlfriend would want.
The only way I could see any woman willing to be committed to use is based on compromises.
Relationships 101, ladies and gentlemen.
I'm not unwilling to compromise, Hawks. I am unwilling to risk a patient's life on an experimental procedure. Stick to the protocol.
Fine. But when I eventually marry this woman, you're getting seated at the kids' table.
Leslie, we have a problem. The patient is in critical condition.
Oh no, that's terrible. What should we do?
I think we need to tell Hawks that the disectomy was not the correct treatment for uterus didelphys.
But how do we break it to him? He was so sure about the diagnosis.
I know, but we can't put the patient's life at risk just to save face.
We have to be honest with him.
I agree. The patient's well-being should be our top priority. Let's just focus on getting her the right treatment now.
You're right. I'll talk to Hawks and we'll figure out the best course of action together.
Thanks for being level-headed about this, Leslie.
Of course, Frank. We're a team and we have to do what's best for the patient. Let's go talk to Hawks.
You imbeciles. You nearly killed the patient with your incompetence. Choosing the wrong disectomy and misdiagnosing the condition. Unbelievable.
I still think it was a case of discotomitis. It was a tricky diagnosis.
No, it was clearly a dyscotomycosis. You all need to brush up on your knowledge.
I disagree. It was definitely dyscotomitis. I stand by my diagnosis.
I think we need to consider discotomychnia. It could have been a possibility.
Are you geniuses coming up with new conditions to explain anything other than the initial diagnosis, but saying disc in front of medical jargon?
You the one always crying about a mystery whenever this happens? Care to explain that one?
Gary's right. What even is a mystery?
Don't press Hawks on it. He has a condition that causes him to say mystery in place of ectomy sometimes.
Is there a name for it? Like Hoxamiri?
Damn it, stick to the disectomy.
Actually, don't. You nearly killed the patient with that. I am leaving. Fix this yourselves.
So, how's it going outside the hospital, Johnson? Any exciting plans for the weekend?
Actually, things have been going pretty well. I've been spending more time with my family and catching up on some reading. It's been refreshing.
That's great to hear. Family time is always important. But hey, have you seen the latest test results for our patient in room 302? They don't seem to add up.
I haven't checked yet, but I can take a look after lunch. What's so puzzling about them?
It's like a piece of a puzzle that doesn't fit. I think I might have an idea of what's going on. Just give me a moment to think this through.
All right, take your time. I'll finish up here and we can go over the results together.
Actually, never mind. I think I've got it. I need to go check on something. See you later, Johnson.
Wait, what? You're leaving just like that? Hawks, what did you figure out?
I'll fill you in later. Trust me, I've got this. See you around.
Man, I wish I actually had a family to brag about.
Sorry for the intrusion, but we don't have time to waste. We need to act fast.
Hawks, what are you doing here without the proper gear? This is unacceptable.
This is a sterile environment, Hawks. You can't just barge in like this.
I can't believe this guy. Does he have any regard for protocol?
Hawks, what's going on? Why are you here? And what's this about uterus didelphys being wrong?
Uterus didelphys was a misdiagnosis. The correct condition is ectopia cordis.
Ectopia cordis? What's the prognosis then?
The prognosis for ectopia cordis is poor. The condition is usually fatal without immediate surgical intervention.
We need to act quickly then. Get the team ready for surgery. This is serious.
Tracy, I finally got the right diagnosis for the patient.
That's great, Hawks. Thanks for your hard work.
If only I didn't have such idiotic doctors to work with, this whole ordeal wouldn't have happened.
What do you mean by that? You were the one who declared the wrong diagnosis. You can't shift the blame to them when you were the one who made the final call, Hawks.
Maybe if you had listened to me when I mentioned my girlfriend from Canada, this wouldn't have happened.
Bringing up an imaginary girlfriend was reckless, Hawks.
She isn't imaginary like your achievements, Tracy. Just shut up.
It was a foolish move, and now you're just trying to deflect blame.
I'm done here. Enjoy dipping chicken fingers in ketchup while you share a table with Gary and Frank miserably failing to reenact the Who's on first bit.